Welcome back to Lifeline Aid, First Aid Essentials for Mining and Industrial Professionals. In this segment, we will be covering essential first aid techniques for dealing with fractures, spinal injuries, head injuries, and eye injuries. These are critical situations, and knowing how to respond effectively can make all the difference in an emergency. Remember, in case of any medical emergency in India, you can call the emergency services at 108 or 112. Fractures. Let's start with fractures, which happen when there's a break or crack in a bone, usually caused by trauma, falls, or direct blows. Signs and symptoms of fractures include pain and swelling, deformity of the affected area, inability to move the injured limb. Here's what you should do if you encounter someone with a fracture. Step 1, immobilize the affected area. Step 2, apply a splint if you're trained. Step 3, cover open fractures with sterile dressings. Important warning, never try to realign the bone. Sprains and strains. Sprains involve injury to ligaments, while strains involve muscles or tendons. These usually occur from twisting, overstretching, or overuse. Signs and symptoms of sprains and strains include pain and swelling, limited movement, bruising. Here's what to do. Step 1, follow the Rice method: rest, ice, compression, and elevation. Important warning, do not apply heat in the first 48 hours. Next topic, head injuries. Head injuries can range from mild to severe. Let's start with concussions. Concussions are mild traumatic brain injuries caused by blows to the head or violent shaking. Signs and symptoms include dizziness, confusion, and headaches, memory loss, and nausea. Here's what to do. Step 1, keep the person awake. Step 2, monitor for worsening symptoms. Step 3, seek medical attention. Important warning, never leave the person unattended. Next, let's talk about compression injuries, which are more serious and involve pressure buildup in the brain due to bleeding or swelling. Signs and symptoms include severe headache, vomiting, unconsciousness, and irregular breathing. Here's what to do. Step 1, call emergency services immediately. Remember to dial 108 or 112. Step 2, keep the person still. Important warning, do not apply pressure to the head. Fractured skull. Fractured skull can result from falls or direct impacts to the head. Signs and symptoms of a fractured skull include bleeding from the ears or nose, bruising around the eyes, unconsciousness. Here's what to do. Step 1, cover the wound with a sterile dressing. Step 2, call emergency services right away. Important warning, do not move the casualty unless absolutely necessary. Let's start with spinal injuries. These occur when there's damage to the spinal cord or vertebrae, typically caused by falls, accidents, or direct trauma. Signs and symptoms of a spinal injury include severe pain, loss of sensation or paralysis, deformity in the spine. If you ever suspect someone has a spinal injury, here's what you should do. Step 1, immobilize the head and neck. This is critical to prevent any further damage to the spine. Step 2, call emergency services immediately. Remember, you can dial 108 or 112. Step 3, do not move the person unless you are trained to do so. Important warning, never twist the casualty's spine unless absolutely necessary or you have the proper training. Incorrect movement could result in permanent damage.
Bye.
Next, let's talk about eye injuries, which can happen due to foreign objects, chemical splashes, or direct trauma to the eye. Signs and symptoms of an eye injury include pain and redness, blurred vision or watering eyes, swelling around the eye. If someone has an eye injury, here's what you should do. Step 1, flush the eye with clean water for at least 10 minutes. This helps to remove any harmful substances or foreign objects. Step 2, cover the eye with a sterile dressing to protect it from further injury. Step 3, seek medical attention immediately by calling 108 or 112. Important warning, do not rub the eye or attempt to remove any embedded objects. This could worsen the injury and lead to permanent damage. That concludes this segment on spinal and eye injuries. Always remember, taking the right steps in the critical moments following an injury can prevent further harm. And in any medical emergency, don't hesitate to call 108 or 112 for help in India. Thank you for watching, and as always, stay prepared, stay safe,